And so I'm Randall Martin, a member of the HAQAST team, and I'll be the moderator for this session for today. And it's a pleasure to introduce and welcome Professor Sheryl Magzamen, who's at Colorado State University, and will lead us off on her work on health disparities from rural agriculture.
So I'm going to try to pack, as most panelists do, a lot of information into a 10-minute talk. So I'd like to talk about health disparities from rural agricultural and prescription burning, as well as urban PM sources to kick us off today. Next slide, please, Alex. So I am a respiratory epidemiologist, and I've been focused on diseases like asthma and chronic obstructive pulmonary disease for most of my career. And traditionally, I've been working in urban locations where, one, we have large population areas, and two, that are monitored fairly extensively by on-ground monitoring networks, such as those provided by the EPA. And here I'm displaying 3 different studies from Oakland, California, all the way on our left, to Denver, Colorado in the middle, and Seattle, Washington, have all been united by really trying to get at intra-city levels of pollution to really understand health effects. In Oakland, it was asthma. In Denver, it has been birth weight and outcomes related to obesity, and Seattle also related to respiratory disease. So trying to find those intra-urban gradients. So when we have, let's say, individual cases that could be geolocated and mapped to understand where high and low levels of pollution are. So my traditional research focus has really been these exposure studies within urban areas and health disparities about what neighborhoods get high levels of exposure, low levels of exposure, specifically to traffic-related air pollution. Next slide, please. And again, most of the research in this field has been facilitated by this extensive on-ground monitoring network that's available through the US EPA. This is a map of our current running PM 2.5 refined particulate matter sites across the country. And if you'll notice, those tend to be in highly populated areas, especially in the Northeast, in the Ohio Valley area, California. And places where I live on the Front Range of Colorado are monitored, but you see that the rest of the Mountain West and the Upper Midwest has more sparsely related monitors compared to more densely populated areas. So of the 3,012 counties in the coterminous United States, only about 1,000 counties have monitoring data that are available to use, that are validated, and that are measured according to federal reference methods. Next slide, please. So that leaves us a lot of space in the US where we don't have this on-ground monitoring network and this constant stream of information to collect data about air quality. So I'm going to start traditionally where I've started in my research, which is traffic-related air pollution and epidemiology. So connecting that air quality to health outcomes. So what do we know? So largely in urban areas, the sources of PM 2.5 air pollution are predictable. Those patterns over space and time are fairly consistent. Temporarily, we may get changes depending on the season, if it's a high traffic season, if it's a heating season. So, but overall, spatially, those patterns don't change much unless there's extensive changes in the infrastructure in the area. So those predicted patterns of exposure in space and time are really aligned where monitors are set. And for these community studies, we also have consistent sets of exposure assessment tools. At the community level, we can use geographic information systems, EPA's fixed site monitors, and other state regulatory monitors, mathematical models such as dispersion models, statistical models such as land use regression, as well as satellite data that's provided by NASA. And on a personal level, we are able to outfit people with low-cost monitors to measure actually what is in the particulate matter, since particulate matter itself is a mixture. We also have flexibility in our epidemiologic study design. So for example, because we have fairly constant sources of pollution over time, we can do prospective studies. So enrolling a cohort of people to measure over time, we can leverage the daily changes in pollution as well as things like hospitalizations and ED visits to do time series studies. And we can look at natural experiments such as policy changes or disasters to understand how changes in intra-urban levels of pollution may impact health outcomes. So here we have consistent predictable exposure assessment, which leads to etiologic data or understanding the health effects of PM 2.5. And my dog decided to bark right now, of course. Next slide, Alex, please. So since arriving, hang on one second while I yell at my dog. Okay, that seems to have worked. So since arriving at Colorado State in 2013, I've been fortunate to collaborate with a number of excellent atmospheric scientists here on campus, and living here has also given us firsthand views of experiencing wildfires and wildfire smoke. Now, smoke is mostly PM 2.5 also, and it's the main outcome that we've been using, exposure we've been using in our health studies. So how does wildfire smoke epidemiology compare and contrast to what we've done in traffic-related air pollution studies? So first, we have unpredictable PM 2.5 patterns over exposure time. And we have a lot of variability in our exposure assessment tools. Here, we tend to use more tools that rely on satellite data, especially, but other tools such as aircraft campaigns and relying heavily on chemical transport models. We are less reliant on fixed site monitors because often wildfire smoke is in areas that are less sparsely populated and less sparsely monitored. The advent of low-cost technology has been helping, but it's really a different paradigm compared to urban areas that usually have a density of on-ground monitors. In terms of personal exposures, we do a lot of occupational studies, and Jamie's going to be able to talk about that a little later in the seminar. However, we have a lot more challenges when it comes to wildfire smoke epidemiology. We do a lot of retrospective studies to try to characterize that PM, again, using satellite data and on-ground monitoring networks. But again, that is looking back in time and seeing who went to the hospital or who went to the ED potentially for a respiratory or cardiovascular visit. There are small studies now emerging that are able to look at prospective, or what happens after wildfire season. And Ava Orr and Aaron Lankuth, who are both based in Montana, have looked at what happens after wildfire events. So understanding lung function, as well as understanding propensity for respiratory infections. So the difference with wildfire smoke epidemiology is that we have variable, unpredictable nature of smoke, and that really requires some creativity for health assessments. Next slide, please, Alex. So agricultural burns, what we're able to do here, have some elements of both traffic-related air pollution and wildfire smoke. And this is a movie that Jeff Pierce put together, thanks Alex, that really kind of show how agricultural burns thread the needle. And this is in the Flint Hills region of Kansas, as well as parts of Missouri. So the agricultural burns, there are predictable patterns of exposure over space and time. For example, seasonal burn patterns. However, there are more limitations in the exposure assessment tools. Again, because these tend to be more rural and less sparsely populated areas, we can't rely as heavily on fixed site monitors. So we do have tools such as chemical transport models, satellite data, and aircraft campaigns that can be used here. However, compared to mega fires that we have here in the Western United States, agricultural burns are relatively smaller, and they need a different suite of Earth observation tools for detection. And again, from a personal perspective, we can do occupational studies. However, unlike wildfire smoke studies, we do have more flexibility in our epidemiologic study designs because we know these ag burns happen at certain specific times of the year, and we have this repeated, consistent pattern of burning. So to summarize agricultural fires, we have consistent, smaller, and more sporadic burns, but requires creativity for exposure assessment rather than more creativity on the epidemiologic side. Next slide, please. So what's really interesting is about thinking of linking agricultural burns to health disparities of exposure from the smoke PM 2.5 generated from these burns. This is a wonderful study published last year by Chris Tessam and his colleagues that show from sectors of the economy based on the national emissions inventory of disparities in exposure based on where that PM 2.5 exposure is coming from. So we see column F represents white population who basically, because they have mostly blue boxes in that column, have less exposure disparity compared to people of color. And then we have different columns for people of color, Black populations, Hispanic, and Asian populations. And I want to draw your attention to agricultural burns specifically, or PM 2.5 from agricultural emissions. And Alex, can you highlight the circles? Perfect. So we see that white populations have a slight disparity in having more exposure to PM 2.5 from agriculture compared to communities from people of color. However, there's quite a bit of heterogeneity and exposure among people of color. And Alex, can you highlight the other circle, please? Perfect. So we see here that Black communities actually have a slightly higher disparity in exposure from agricultural smoke, while other communities of color have lower exposure to agricultural smoke. So really what this slide is highlighting is that disparities in exposure to PM 2.5 is not just an urban problem, but a problem in agricultural communities as well. Next slide, please. And this was brought to our attention by folks in Florida, and this is Palm Beach County. This is one of our testbed communities that we'll be looking at with our HAQAST project. And here on the left, these two maps are showing Palm Beach County by census tract. Race, white is on the left, and Black non-Hispanic by census tract is on the right. So most of us are familiar with Palm Beach County, or at least I am. I'll show my bias by the beach communities such as Boca Raton and West Palm Beach. But Palm Beach County has an incredible amount of agricultural space that's highlighted by that Everglades agricultural area in the center of the county, south and due east of Lake Okeechobee. And there's actually several communities that have incredibly high populations of Black non-Hispanic residents. And those are actually communities that are also heavily impacted by sugarcane burning in that area. So sugarcane burning comprises about 440,000 acres of planting. I'm sorry, sugarcane production comprises about 440,000 acres of planting in the Everglades agricultural area. And there are some concerns about crop residue burning in the area and the smoke and PM 2.5 exposures from those burns. Next slide, please. So the HAQAST team—
Sheryl, we're running a little bit out of time, so if you could wrap up.
Thanks, Alex. Sure. So the HAQAST team that I co-lead with Amber Soja is addressing the smoke that comes from not only these agricultural burns in Florida, but other burns that happen in Kansas as well. Next slide, please. So this is some of our data trying to, again, understand, for example, the Flint Hills burning in Kansas, using satellite image showing fire hotspots and small smoke plumes, and trying to understand not only where fire days occur, but where smoke emanates from these fires. Next slide, please. So our plan is to combine NASA Earth observation data with low-cost monitors in both Florida and Kansas. And here that's one of our grad students testing these monitors, and use fused Earth observation data to estimate smoke exposure for agricultural burns, both in the Flint Hills of Kansas and Western Palm Beach County. And our goals here are really to estimate, using these multiple tools, the smoke to PM 2.5 before, during, and following the burn seasons. Next slide, please. So again, just to reiterate some discussion points, that agricultural burns as well as wildfire smoke is really changing our understanding about how to measure PM 2.5, as well as how to implement health studies to understand the health effects of PM 2.5 also. And they're all slightly different, which is requiring us to be a little more creative, not only about the way we do our epidemiologic studies, but the way we capture PM 2.5. And here, leveraging NASA Earth observation products is really a huge goal of our study looking at agricultural burns. And on the last slide, just wanted to say thank you to all the people that are involved in our study. Thanks for your time today.
Awesome.
Thank you, Sheryl, for that fascinating talk. And so following the procedure as before, what we'll do is we'll hold questions for now. Please do enter them in the chat. We'll pick those up afterward, and we'll move on to our next speaker to continue this theme, and that will be Amber Soja. And I'm not yet seeing your screen.
I'm not either. Did you want me to start slides? I don't see the video or the slide. I don't think I have any control.
Sure. So I can try to start your camera here. Would you like to share your slides, or I can also share slides too?
Oh, I thought you were going to do it. I could do it too.
Either
Go
works
ahead.
for you. Okay.
Yeah.
Perfect. I will share these slides here, and then I will also try to get your camera rolling here. There should be a little pop-up that might come up for you.
Yep, just did.
Awesome. And
Okay.
these are the slides.
All right, great. So what I'd like to talk about today is burning in the southeastern United States. You'll see a lot of names on this this first page, and that's because we are working with a lot of people and we want your opinions. And so these are about half of our stakeholders, but we would like to invite you to be part of our team, because if the data isn't useful, then let's try to make it useful. Our Tiger team is focused with Sheryl and her teams on the Flint Hill burning and also the sugarcane burning in Florida. But today we're going to talk about how we're going to generate that data, and we want your input. Let us know if you want something different, how we're doing it wrong or right, and you're welcome to be part of our team. Next slide, please. So we know that smoke is a pollutant that results in respiratory diseases, cardiovascular symptoms, heart failure, and death. That's a known. And we know that fire and actioning fire and the cost to real estate is in the billions. It's very expensive. And air quality and health cost rival those costs, and in some years are greater than those costs. However, what you might not know is that wildland fire is, even though it has notoriety in the West, in the Southeast and Central United States, in terms of burned area, it's often equivalent to wildland fire burning in a normal wildland fire year. And there's just a lot we don't know about fire in the Southeast because we haven't been previously capable of capturing these signals from space. Next slide, please. So I do want to highlight, because there's been a lot of back talk about all of this, and that's fires are a completely natural process. We want fire on our landscapes. We are not trying to get rid of fire. Fire has a lot of benefits. It decreases fuel, so we have safer communities and safer firefighters. We can select for the species and the flora and fauna that we want on our landscapes. We can decrease invasive species, cycle nutrients, and fires have a lot of values on our landscape. On the right-hand side top panel, you're looking at the horizontal view of active fire detections in red and smoke in gray. And in the bottom panel, you can see this little slice, and we've highlighted the vertical extent of smoke. And in this case, the smoke is going all the way to the ground, where it is really bad for air quality. So it's not only the fires and the air quality, the fires and the horizontal extent of the smoke, it's the vertical extent of the smoke. We need to think of all of it when we balance fire and smoke on our landscapes. So how it interacts in our environment. We need to learn to live with fire on our landscapes and know the science so that we can make these balances all as climate changes. So a lot of choices and knowledge that we need here. Next slide, please. And one example is the sequoias that have burned the last couple years on the right-hand side of the slide. And sequoias are adapted to fire. They have really thick bark. They've lived for hundreds and thousands of years with drought, with fire. They know how to deal with drought and fire, except that now our only temperate rainforests on Earth are threatened because of these fires. So in the bottom right, we can see this sequoia forest that has a lot of fuels that are built up. That's what happens when you don't allow fire on the landscape. You need fires to clean out this understory. And what happens is when a fire burns there, the trees are going to die because it's an extreme fire. And the fire adapted communities are adapted to more moderate and low severity type fires, like the landscape shown in the middle panel. On the far left, we're looking at a fire break muddy road in the Southeast and a fire that Johnny Stowe is starting. And fires have been on the landscape in the Southeast for hundreds of years. They clean the fuels, they keep what we want, the flora and fauna on the landscape. Next slide, please. So basically what I'm going to talk about is the science that we're going to use to inform health and air quality assessments. We're going to briefly look at results from FireXAQ that relate to HAQAST. And then I'm going to show you a methodology and hope that you're interested in these data. Next slide, please. So Fire XAQ was an aircraft campaign. And what we did is we looked at the fuels on the ground, and we also looked at the data from space so that we could determine how well we can see fire in terms of fire detections and burned area on the ground. Next slide, please. On the top panel is the fire that we named Up. On the bottom panel is focused on the fire we named Yentl Kingpin. On the far left is very high and high resolution data that show pre-burn fires. The second panel over shows the burning fields and how we've digitized them. And if you look at the panels on the right-hand side, you can see that these fires green up within days. So we have to digitize them and look for data pre-fire, post-fire in order to get a handle of these burned areas because they change quickly. Next slide, please. That's why they're so tough they're challenging. With fire detections, VIIRS was able to capture 52% of the fires we sampled. With MODIS, 17%, and with GOES, the most, that's 63% of the fires that we detected. That's because GOES is overhead all the time, so we can get 5-minute data from GOES, but the resolution is 2 kilometers, so it's not as geographically accurate. Next slide, please. If we take the fire detections and then we look at the digitized burned area, it looks like MODIS compares best to, even though it was the least fire detections. This doesn't mean it's the best product. It just means that we need to look at the science of these data. VIIRS has the highest resolution and the largest number of detections per area. So we need to think about this. Is it because the fuels are burning down? Or what kind of fires are these? There's a lot of unknowns, and so we're just beginning to touch the surface. Next slide, please. Now that we've shown you what the results are from Fire XAQ, we're going to talk about what we're going to do on the Flint Hills and the sugarcane fields. So on the Flint Hills, we're showing this ecosystem on the left-hand side. And on the right-hand side, we're showing some long-term satellite data analysis. The top panel is burned area, and the bottom panel is fire detections over time. So what we're showing is the timing of the fire. So we know from people on the ground and also from satellite data that most of the fire in the Flint Hills occurs in March and April. Next slide, please. So what we plan to do is we plan to randomly lay 5x5 kilometer tiles on the landscape. And then we're going to randomly select 5% of these tiles. And we're going to define and label the scars and pre and post burn images like you saw done in Fire XAQ. Next slide, please. So if we look at this landscape between March 25th and April 15th, that is the time that defines 82% of the burned area historically. So we think we'll get a good picture of these fires. And the data from high and very high resolution data are available. Next slide, please. So next, we have a little different story, the sugarcane burning in Florida. And that's because if we look at the MODIS burned area and the top panel, we can see that there are a lot of different months where sugarcane is burning, and the MODIS fire detections on the bottom panel. And it's about 5 months that we'll need to look at data for this particular fire regime. Next slide, please. So if we overlay the same 5x5 tiling on the sugarcane fields and take, again, 5% of the data, it's only 10 tiles. And you may say, that's not very much. But then if you think about it, it's 10 tiles and 5 months of data and of burning. So next slide, please. So if we look at between September 15th and February 15th, we can see that it's a dog day. 90% of the burned area has historically fallen within this time frame. All right, guys. There's someone at my door and no one is answering it. So that's 1,500 tiles to view and burned area. Next slide, please. So our goal is to provide data and information necessary to establish the relationships between fire and human health. So we're providing the baseline data in these understudied regions that we really have not well quantified. Prescription burning isn't going away. Cropland burning isn't going away, but we need to have the science and the data to ask the right health questions, to ask the right questions on our landscape. So with this accurate information, and then we can start to have the information to balance what are the social costs and the policy trade-offs on our landscapes. And with that, that's my last slide. One more slide, and all it is thank you. And we really would like to have stakeholders, so please get in touch with us. Thanks very much.
Oh, thank you, Amber, for that exciting talk. And again, we'll please do enter questions into the Q&A, and we'll move on then to our third speaker for this session, Dr. Sina Hasheminassab from the South Coast Air Quality Management District.
Thanks, Randall. Alex, if it's okay, I want to share my screen.
Yeah, that's great.
All right. Good afternoon, everyone. And today in this presentation, I'm going to talk about a recently established program that aims to address air pollution disparities in underserved communities of California. I will provide an overview of this initiative and then specifically focus on the air monitoring aspects of this program in the South Coast Air Basin. So as many of you know, air quality generally has improved in the US over the past decades. And for example, in the plot to the right, you see the annual trends of PM2.5 and ozone in the South Coast Air Basin as compared to 1990s. And it is quite clear that the levels of these pollutants have come down significantly. And it's also important to note that these improvements have been achieved while we see a significant increase in population, GDP, and employment at the same time. Despite significant improvement in regional air quality, there are still large air pollution disparities at local scales. The map on this slide, for example, shows the estimated diesel PM by census tracts in the Los Angeles area. And as you can see, there are several communities in which diesel PM emissions are substantially higher than the rest of the region. Many of these communities are low-income communities of colors and minorities, who also tend to be more vulnerable to air pollution exposure. So to address this issue, in 2017, State of California enacted a statewide program known as Assembly Bill 617 or 8617 to reduce exposure in communities most impacted by air pollution. There are 5 important components to this program, including community air quality monitoring, which is the focus of my presentation today. But in addition to that, there is community emission reduction plans, which is essentially a set of strategies that are defined or designed to reduce emissions from the sources that exist in these communities. This program also provides funding for clean technology investments, as well as accelerating the retrofit of pollution control measures. Finally, another goal of this program is to provide easier access to the data for the community members. What makes this program quite unique and different from previous initiatives is that community partnership is at the center of this program, and community members essentially lead the entire program. So every year, a number of communities are selected and added to this program by California Air Resources Board. So far, over the past 4 years, 15 communities have been selected throughout the state of California that you can see here on the map. And out of those 15 communities, 6 of them fall within the South Coast AQMD's jurisdiction. Here is a closer look at those 6 communities in the South Coast AQMD's area. You can also see the community boundaries in red. So once a community is selected for this program, local air districts start meeting regularly with the community members. First, to identify air quality concerns and the associated air pollution sources that exist in their communities. And once those concerns have been identified, staff work closely with the community members to define and develop two important plans. One plan is for emission reductions, and as I said earlier, it lays out strategies for reducing emissions from the identified sources. Another plan is for community air quality monitoring. And once these plans are developed, the air districts start implementing them in the communities. Then in the regular meetings with the community members, staff of the air districts provide progress reports and gather communities' feedback for the next steps of the program. I should also mention that the implementation process usually takes at least a couple of years until the emissions from the identified sources are mitigated. So here I have listed some of the most important air quality concerns that have been identified by the communities so far. And as you can see, there is a wide variety of air pollution sources that could emit many different air pollutants. So we do air quality monitoring as part of this program for a number of reasons. One of them is to identify emission sources and also identify the pollutants of concerns. Another objective of air quality monitoring is to assess the community level exposure. Another important reason of air quality monitoring is to establish a baseline and track the progress of emission reduction. As I said earlier, essentially the end goal of this program is to reduce air pollution in these communities. So it's important to have continuous monitors in place to be able to track this progress over time. Another important purpose of monitoring is to provide actionable information to community members, as well as planners and regulators. And these informations will be helpful in decision-making processes that is imperative throughout this program. So we use a variety of air monitoring tools to quantify the impact of air pollution sources that have been identified by the community members. We can generally classify these air monitoring tools in three different classes. On the top, you see the accepted guidance methods, which are essentially the EPA approved methods. We also use research grade tools that includes mobile platforms as well as some advanced air monitors, which I will talk about them in a moment. We also use low-cost sensor and sensor networks to complement the other two classes of monitoring tools. So depending on the objective of air monitoring, we use different combination of these tools. This slide provides a general overview of our monitoring approach in these communities. We usually start with mobile monitoring that allows us to do wide area surveys in these communities. And that helps us to identify hotspots and areas of concerns. It also assists us in identifying some potential unknown sources of emissions. Once the areas of concerns have been identified, or the areas with persistent levels of high levels of air pollution, then we can follow up with stationary monitoring. We can basically deploy our stationary monitors there to assess the levels over longer term, and also to characterize emissions from the identified suspect facilities. We also use low-cost sensors to complement the other two strategies to gain a better understanding of the spatial variation of certain pollutants within the communities. Sensors are also great tools to engage community members in air pollution measurements. So for mobile air quality monitoring, we have a fleet of mobile platforms in-house. Each of these mobile platforms are equipped with certain type of instruments that can measure specific air pollutants and therefore address specific air quality concerns that have been identified by the community members. For example, the platform on the far left is equipped with instruments that can measure particle mass and number in different size ranges, as well as black carbon and NOx, which makes it very appropriate to track or address emissions from truck traffic and rail yards. We are also developing a mobile platform that has a monitor on board that is capable of measuring multiple metals with high time resolution, which makes it very suitable for addressing emission from metal processing facilities, auto body shops, and essentially any other sources that is known to emit particulate metals. The other two mobile platforms are equipped with instruments that can measure VOCs such as BTEX, as well as total alkanes, SO2, and methane. And therefore, we can use these platforms to address emissions from sources such as refineries, oil wells, as well as rendering and waste facilities. When it comes to stationary monitors, again, we definitely use accepted methods, such as those have been approved by EPA. But in addition to that, we do use advanced research grade tools as well. And the reason that you see the picture of mobile platforms here is that we use them in stationary modes as well to better characterize emissions from certain facilities or in some areas of concerns. And again, low-cost sensors are another great tool that could complement the other two sets of monitors for stationary monitoring. One of the main advantages of low-cost sensors is that you can saturate a community with so many of these sensors. And in that case, you would be able to gain a better understanding of the spatial variation of certain pollutants. Perhaps a good example is on the map on the right, where you can see the gradients of PM2.5 shown by the purple map in September of 2020, when we had the Bobcat fire here in the basin. Another advantage of using low-cost sensors is for community engagement and education. So this is my last slide before I conclude my presentation. And since we are in the HAQAST meeting, I also wanted to briefly touch on the ways that satellite remote sensing could potentially complement the work that we are doing on the ground. So far, all of our focus has been on using in situ air quality monitors to do air quality monitoring. But in my view, satellites could potentially help us in mapping exposure levels in these communities. They could also help us identify hotspots, track the progress, discover unknown sources of emissions as well. But some of the points that we have to keep in mind when thinking about satellite data are what are the pollutants that can be measured with satellites? As I said earlier, there are a wide range of sources that have been identified by the community members, and many of them actually emit air toxics, which are usually in trace amounts in the atmosphere. And because of the nature of these short-lived pollutants, they also vary substantially in local, in small spatial scales. So that's another factor that we need to keep in mind when thinking about satellite remote sensing, spatial resolution. Another factor is, of course, the temporal resolution that's as important as the spatial resolution when it comes to the satellite data. So I would leave these here, and then if needed during the Q&A session, we can get back to them. Thanks.
Well, thank you, Sina, for that fascinating talk. And again, as before, please do enter your questions within the Q&A. And at this point, we'll move on to our fourth speaker for the session, Professor Jaime Butler-Dawson, from the Colorado School of Public Health.
Great, thanks for having me this afternoon. So I work at the Center for Health Work and Environment at the Colorado School of Public Health, and I'm going to talk about some of the research I've been doing in Latin America among sugarcane cutters, examining environmental and occupational exposures and their potential role in the epidemic of chronic kidney disease of unknown origin. Next slide, please. So workers have been in the news a lot lately. Here's a couple headlines showing how extreme weather events have impacted these workers. We have a lot of heat headlines and fires and landslides. So this was just showing all the different types of exposures that workers have here in the US. Next slide, please. So why are workers so vulnerable to climate-related impacts? So workers, their exposures are often greater in frequency, duration, and intensity than general populations. And often workers can't escape these hazards. They can't quit their job, or they don't get paid as much if they rest more in the shade. So climate change intensifies existing workplace safety and health hazards. So including there's heat stress, extreme weather events, and exposure to different chemicals and pathogens. And these are both old hazards and also new emerging hazards. Other impacts that we don't really think about as much are workers' well-being. Their work performance could be affected, decreased productivity, working hours are shifted, maybe to the nighttime where it's not so hot, an increased rate of injuries and also disease. Next slide, please. In the past, I've mainly focused on heat exposures as well as environmental exposures like metals in the water with sugarcane cutters, and just a macro level picture of why that matters to everyone in the world. So these high temperatures will lead to less productivity and less labor supply, which will lead to lower food production and higher food prices locally, nationally, and worldwide. And I know this panel is about air quality, but there's really not a lot of data on air quality and productivity in agriculture, and we've really focused on heat, but now we'll be leading into air quality. I'll go into that in a couple slides, but this is just a figure from a paper that our team published at the center, showing how heat could affect productivity. So on the y-axis is average wet bulb globe temperature, shown in red here. And that just is a measure of how hot it feels. So it takes into account the heat, temperature, wind speed, radiation. But this shows that as these temperatures rise, productivity decreases. So this is a figure from a paper looking at sugarcane cutters, and they are paid by the amount of ton they cut each day. So that's how productive they are. So this black line is looking at average tons of sugarcane cut. And what's interesting is you see this relationship, but also if workers come into the 6-month harvest season with poor kidney function, this relationship between temperature and productivity is amplified. And also workers are more likely to quit during the 6-month season if they have poor kidney health. Next slide, please. So I just wanted to talk about 2 studies that I'm currently involved in Latin America, mainly in Guatemala right now. So study 1, we're looking at particulate exposure and kidney health. This is a 5-year study we just started, and the study population is male sugarcane cutters in Guatemala, in Southwest Guatemala. So we'll be characterizing occupational airborne exposures, as well as occupational heat stress. And also looking at recovery at home. So when the sugarcane cutters go home, are they able to recover? Are their houses too hot, or is there airborne exposures at their house as well? So they don't really get recovery at home. So we're looking more into that. And then study 2 is it's a career development grant that I'm a part of. It's looking at women's airborne exposure and kidney health in Guatemala. So this is looking at female seeders hired by a sugarcane company, and also community members, females that are not part of the sugarcane company. And this study will be looking at occupational and household airborne exposures. So what are the women exposed to at work when they're seeding the sugarcane, and then what are they exposed to when they go home and have their rest day? And they're probably the main cook of the house as well. And then the study is also going to be measuring organic chemicals using silicone wristbands that they wear during the day, and then also heat exposure. And here's a picture of the silicone wristbands that the workers will wear. Next slide, please. And just real briefly, just a little more about our outcome. So it's chronic kidney disease of unknown origin, and it's a progressive loss of kidney function, which can progress rapidly into end-stage renal failure. So the cause is not known at this time, and it's not linked to diabetes or hypertension. So in the developed world, usually chronic kidney disease is related to diabetes and hypertension and age and obesity. But in these populations where these epidemics are occurring, here in the red dots, these are young populations, and they're not obese, they don't have diabetes nor hypertension. So these epidemics around the world have emerged in clusters in the past 2 decades. Usually it's found in hot and humid regions, and poor agricultural communities are highly affected, specifically male agricultural workers such as sugarcane cutters, and it's a relatively younger population. The literature suggests that there's probably multiple causes, like there's not just one cause. So research has been examining, is it recurrent dehydration with heat stress, environmental exposures, looking at air quality, metals, and agrochemicals, and then are there synergistic effects? And that's what our studies are currently looking at. So as their heat exposure plus these airborne exposures. Next slide, please. So the rationale for our studies are that our study population is sugarcane cutters. And these sugarcane fields are burned prior to harvesting the cane. So the cutters come in and they manually cut the sugarcane with a machete, and burning the sugarcane facilitates this cutting with a machete. So these workers and then surrounding communities surrounding the plantation may have daily exposures to high levels of particulate matter, soil, and ash, which contain silica, metals, and glyphosate. And silica and metals occur naturally in the soil and also in the sugarcane because of the volcanic region in the area. So we'll be looking at, in these studies, agricultural and household biomass burning. So what are these workers exposed to occupationally and then when they go home? And these exposures may lead to an inflammatory response that drives kidney injury, which may lead to chronic kidney disease of unknown origin. Next slide, please. And so we initiated these studies in December, so I was down there, so I took these pictures. So the top left picture is our field team collecting urine and blood samples from a cohort of workers, and you can see they're burning the neighboring field as we were collecting the urine samples from these workers. On the right here is a sugarcane cutter. He's covered in black soot after working 10 hours in the field. And these workers are paid by the amount of cane they cut and averaging about 6 tons of cane a day. And then here's just another picture of a different type of burn. Next slide, please. So for the men study, we'll be measuring particulate matter, silica, metals, and glyphosate, like I said. So we're trying to figure out a way to measure their airborne pollutants and how do we attach the individual air sampler. So we came up with this device. So we have a running vest. And here we have attached the cyclone right here, and the pumps in the back. There's a pocket that's conveniently located in the back. So put the pump in the back, and then you attach it with zip ties here. And here's the cyclone. And then we also have this number 18. It's an I button, which measures ambient temperature and humidity. And then for the women, same setup here with the running vest. Here they are wearing the silicone wristbands, and we're measuring particulate matter, metals, and a number of chemicals. Next slide, please. And then in these studies, we're also measuring heat exposure. So we're looking at weather station data and also field data, wet bulb globe temperature. And then for the men study, we'll be measuring individual core body temperature, where they take a pill and we can connect it to a Bluetooth meter and measure what their core body temperature is throughout the work shift. And then also the individual ambient temperature and humidity with these I buttons here. Next slide, please. And so for the future research goals, looking at examining the relationships between these climate metrics. So we have field and individual, exploring synergistic exposure effects. So if these workers are exposed to poor air quality and then they have heat stress, are they more likely to have poor kidney outcomes? And then also assess the exposure effects on worker health and well-being and productivity. So we're hoping to build on our existing worker health and safety interventions in Latin America. We've already implemented several interventions looking at increasing water, electrolytes, rest and shade with these workers, and then we're doing kidney and injury surveillance. Next slide, please. And I would just like to thank a number of people who are part of this research, both in Guatemala at Pantaleon, the sugarcane company, and then at University of Colorado and CSU. Thank you.
Thank you, Jaime. And so at this point, we now have time for questions. And I'll kick it off with a question of my own that I've been thinking through. We've heard a lot about different types of sensors across different spatial and temporal scales. And I'm interested in particular with, for Sheryl and Amber, if you could speak to how you intend to relate the satellite observations, which are by definition over an area, with the ground level monitors, which are explicitly at a point. And so in a long-term average, that there could be random errors that reduce the representativeness bias. But as one goes toward shorter timescales, which is of relevance when we're looking at fire smoke, then I'm wondering how you intend to deal with those representativeness biases that can occur really on very short timescales.
Who wants to go first?
I can go first, Amber. I would say carefully is the answer to your question, Randall. And I think that we have had success in the past about just triangulating. I feel like every exposure assessment method we use, and Sina, please jump in here as well, has its inherent limitations. So for example, using, I would say, aerosol optical depth, we have issues with cloud cover. We have issues about actually knowing what's on the ground, whether that, detection in the atmosphere column is actually impacting ground level measurements. So what our strategies have been is to try to tie everything to FRM measurements on the ground in previous studies. We've had success doing that in, I would say, in wildfire studies, in terms of looking at places like Washington State, for example, where the Department of Ecology puts out a number of FRM or FEM monitors during wildfire season. So we have a lot more on the ground information. And using statistical techniques like geo-weighted regression. We have some challenges with that for sure. And I think a lot of that has to do with the precision and bias you mentioned. And I'll just mention two that we're grappling with. One is that we don't have a clear definition of what smoke is. So one of our major challenges is thinking about, if we're calling smoke PM 2.5, what we generally do is figure out what the PM 2.5 level is from those ground-based monitors on days where there's not smoke in the atmosphere column, and call those non-smoke days. And then on smoke days, how we identify the smoke PM 2.5 is saying anything that's above that seasonal or daily average, that's what we call smoke. And that is a very, very imprecise way to identify a smoke day. So I think that this is an area of active research in exposure assessment communities. And what we haven't had yet is a kind of an agreement, because if you look at some of the air pollution epidemiology papers, everyone's measuring smoke in a different way. Some people are using HMS plumes or the hazard mapping system plumes from NOAA. Some people are using AOD. Some people are using EPA, low-cost monitors, mobile monitors. So there's a whole suite of tools, as Sina really nicely identified, that the South Coast Air Quality Management District is using. But we haven't, I think, had a agreement on what best approaches are at this point. And I'm hoping that that's because we have so many great exposure assessment thinkers in the HAQAST team, is that maybe we can come to some kind of harmonization on different approaches and what the benefits and the negatives, especially from, as you said, a precision and bias perspective, are for each of those approaches. So open question, I would say, right now.
Thank you, Sheryl. That was a terrific answer. Amber, did you have more you'd like to add before we open up for other questions?
Yes, I would kind of like to add a little bit. So if we're thinking about AOD or the HMS hazard mapping system smoke that's hand drawn, we don't have the vertical, so we don't know if it's at the ground. So that's part of it. So I think that what we're going to add to this study is, one, Sheryl has 50 extra sensors that she's putting out. We know where they are. We know where the other sensors are, and we can't look at very high resolution data in near real time, but we're going to know what day it burned, and we're going to know what size the field is. So we'll be able to estimate the smoke. So I think we'll be able to pull together a good answer at that area, at that space and time, that's different than what we've seen before. So we'll know it's burning, we'll have the smoke, we'll have the emissions at a particular space and time. Whatever that resolution is, we can define it, which isn't always tied to AOD. Particularly if you're looking at the whole column, what matters is what's here in terms of health. And so you need both. You need both estimates. And what's different is a very high resolution data. That's different.
Terrific. Well, thank you very much, Amber. And so going to the questions that are available, the first one is from Pawan Gupta, and this question is to Sina. And the question is that there are concerns on data quality for both low-cost sensors and satellite data with respect to FEM versus FRMs. And how big is this obstacle in using these new technologies, or how can they be used effectively?
Yeah, that's a very good point. And that's actually something that the community members keep asking us as well, especially when it comes to the use of low-cost sensors in their communities. But something that we remind them, and we should also keep in mind, is that we use these tools as surveys to guide us where to put our additional resources. That even applies to our mobile platforms, which is equipped with very advanced monitors, not necessarily FEM or FRM. We use these tools to gain an overview or big picture of the situation in the community. And then when those monitoring tools identify some areas that require more attention, then we would follow up with deploying some FRM and FEMs in those areas. Because clearly, it is not feasible to saturate a community with so many reference monitors. So again, like we use low-cost sensors, mobile platforms, and even satellite data, which we haven't used yet, but that could be another tool that could guide us where to put our resources and attention.
Perfect. Thanks, Sina. I see a question for Jaime that's in the Q&A. And Jaime, it seems like you might be typing an answer. So I wanted to ask if you'd like to respond verbally, or if you're addressing it through typing, and if so, we can move on to another question.
I was typing it right now, so I can continue.
Okay.
So we have time. You guys could look at it.
In that case, I'll turn to a question back for Sheryl then. And this question is from Malcolm Zachariah. And the question is, what the health epidemiology data that will be compared to the ones from fire and smoke? And then there's a second part for Amber that I guess I'll ask at this time, since you two are coordinating very well with each other, which is how much work needs to be done to analyze the burned scar tiles, and could it ever be automated? So first, over to you, Sheryl.
Yep. Thanks, Randall. Malcolm, I think I saw you're from Oklahoma DEQ. So I was a great partner for me when I was at OU. So I'm glad you were attending the session today. So we, of course, the funding available for this HAQAST study is not an NIH-sized grant, unfortunately. So our first attempt in terms of classifying or trying to quantify health outcomes is really in partnership with Chris Ruggiero, who's on the call today, and trying to look at hospitalizations and ED visits from Florida and leveraging work that's been done by Holly Noel and Chris Holmes at Florida State, looking at pollution surfaces during the year that also highlight the ability to actually track PM2.5 plumes from the sugarcane burns. So our first attempt at trying to quantify the health effects from these agricultural fires in Florida will be fairly similar to those that we have done for other wildfire smoke and other biomass studies that we've done here in the US. I will say that we have plans right now with other locations in the US, working with the state of New Mexico, to try to look at prospective studies where prescribed burns that are agricultural in the sense that they're done by the Forest Service impact subacute asthma exacerbations using GPS-enabled asthma inhalers to understand deployment of rescue medication during high levels of PM2.5 due to smoke events in an area that generally has fairly low levels of PM2.5 and other sources. So we're starting with traditional methods that we know, and then trying to move on and leverage, again, these patterns of known of burns in terms of timing and location to have more prospective studies and get at some of these etiologic questions.
Thanks. And Amber, do you recall the question or should I read it again?
Yeah, no, I see it. I read it again.
Oh,
So
okay, perfect.
A lot more work needs to be done, Malcolm, and we welcome help actually from this community if anybody has any extra students, because there's a lot more to digitize than you might imagine, and we need help. So we're looking for students and we're looking for people that are interested in this project, and we will pay them. So yes, we need a lot more help on the Planet data and the Sentinel data. Sentinel data is public, so anybody can get it. Yes, I absolutely think it should be, it could be automated, but not yet, because you need baseline data, and that's part of what we're generating. That's why we're doing it so statistically, is because we want to have the baseline data so that the product can be automated in the future. Planet data is commercial. We have a NASA data buy, so through this HAQAST project, I'm allowed to use it. I can share my product, but we can't share the data. It's quite expensive right now, and we're not allowed to share that part of it. So that can't be automated yet. So that's the answer.
Thanks, Amber. And there's a follow-up question from Tom Moore that is also directed to you. And it's asking if you're saying that smoke equals AOD, referencing Sheryl's point about no consensus definition for smoke, and whether we need a composite remotely sensed indicator that has defined uncertainties to what humans are breathing.
I'll take my part of it. I think that there are several papers where if I was estimating emissions, I would estimate the carbon and then take the species specific emissions. So I think my scientific definition of smoke, I think I know all the chemical constituents of smoke. I think that it might get complicated, like Sheryl was saying, if you're looking at a monitor that only measures PM10 or PM2.5, like what else is measured by these particular monitors? So that might be part of the difference in issues. So if I was estimating from a fire, I would know exactly what to estimate in terms of smoke, carbon, and emissions, because this work has already been done. But if you're a monitor and looking at that data, I think she's saying, how do you define fire just looking at the monitors? AOD, you don't know where it is in the vertical. So I think it's great data and it gives us lots of information. But if you're being specific about health and we want to move forward, then at some point we're going to need to get at nose level. We need to get at nose level. So that's going back to monitors again. And I'm going to, so I've said what I think about smoke, and I think that I'll let Sheryl take over from there.
Sure, thanks, Amber. And Tom, I definitely want to acknowledge your point that you're in the chat, that we know that smoke is not just PM, that there is, gases, and that Emily Fisher's done some lovely work on trying to understand the HAPs especially from fresh smoke. So we know that it's many, many things, that smoke itself is a mixture, as the PM is a mixture too. I think from a health community, we base the PM on really what's available at the ground, what's monitored, as well as what we can measure from Earth observation. So there's good data that, of the health effects of PM from, years and years of studies, but we know that's not the only thing out there. And, I definitely want to acknowledge your point for that. I would say in terms of what we do for ambient air pollution measurement, we know that exposure does not equal dose. And we know that people spend the majority of their time inside, that all PM is not created equal. Randall and I have actually had some conversations about that in the past. So this idea about, trying to estimate what PM, whether it's anthropogenic or biogenic, is in ambient conditions does not equate to what people actually breathe in. And I know Jaime is acutely aware of that, working with occupational settings. And even if we outfit people with low-cost monitors, there's still challenges in terms of actually getting an effective biological dose based on whether personal protective equipment is being worn or other potential dynamics in both an indoor and outdoor environment. So it's a question that we grapple with a lot in air pollution epidemiology in general, knowing that in terms of talking about potential biases, there's so much that we don't capture in terms of human movement and human potential protection, especially in indoor environments. And that kind of has plagued air pollution epidemiology from the get-go. So these low-cost monitors as well as personal monitors are trying to get at that effective exposure, but then there's the challenge of characterizing where that PM comes from. So again, I think the advent of low-cost monitors, and again, this triangulation between satellites, low-cost monitors, mobile monitors, and on-ground monitors are helping us get at that point, along with things that people may not want to share, like their location at a certain time and place. So we're getting there, but I think overall the message is still that PM is bad for our health, and really how do we mitigate those exposures is a critical question now for environmental and public health researchers.
Perfect. Thank you, Sheryl. And so that completes the set of questions that I see in the Q&A. And I'll just pause to see if anyone on the panel has anything they would like to add. We're nearly used up our time. We have just a few minutes left, but I'll just open it up for any last comments from the panel. And if there are none, then over to you, Alex, to close us out.
Sheryl, you can go. Yeah.
Oh, thanks, Alex. I just want to say
Sorry,
I
Sheryl,
put up my hand very late, Randall, not a problem. One, I really appreciate everyone's perspective. I appreciate the questions, and I really appreciate HAQAST, because I think, and Jaime, I don't want to speak for you, the circles that we travel in academically sometimes don't intersect, right? We have kind of our atmospheric scientists, we have our measurement folks, our engineering folks, and health folks. And this really gives us an opportunity to think through these problems together. And I personally and professionally don't have a lot of opportunities to have these really diverse audiences to talk about the number of issues that we've covered today. So I really appreciate, again, the opportunity that HAQAST gives us to have these conversations, and hope we can continue these as the projects move forward.
Thank you, Sheryl. That was terrific closure.
Yeah, such kind words. Thank you so much, Sheryl.
I don't know. Do we have more time? Is our session already over? It seems like there's a lot of conversation in the chat.
We have about 5 minutes, so we have a little bit of time
Okay.
if you want to address anything.
Well, it looks like levoglucosin is mentioned in the chat, and it's measured by aircraft and other measurements. So I've definitely seen that as a tracer. And FireXAQ actually has full constituents, and it's a flying laboratory. It's a really huge laboratory on the DC-8. And from FireXAQ, there's all the chemicals that were flown from all the prescribed in agriculture and wildland fires. And also Emily Fisher did a lot of work in the year before in 2018 sponsored by NSF. So there's lots of the chemical analysis out there for particular fires. Emily, because it was a bigger fire season, they're more mixed fires, but there's lots of good data, and that's answering, I think, Malcolm's question and also Tom's. So, and I think because to feed on what Sheryl said, because we're coming from different communities, we look at it differently. It's like, what can you get at this position in time? And that's why actually this conversation is really good, because I think Sheryl and I have ideas of what we can do to pull together even better, and ways that we never thought of. It's like it's defining new terms. It's the difference between ecology and atmospheric chemistry. So we've, with your help, we've defined new terms here, or know that we weren't speaking the same language. So thanks, all of you.
And thanks, Amber, for picking up that question that just came in as we were closing out.
Looks like there's another one coming in from Tom. Maybe we can do that for the last 2 minutes.
Sure. Okay. So one more from Tom, which will be our last question then. And so this question is, are emissions estimated at the point of combustion, downwind, some distances, or after oxidation? My hypothesis is that remote sensing does not measure smoke, but subset components. just like ambient ground-based monitors or one-time field studies? Can results from research studies at one specific area for a limited time frame for a unique constellation of fire sources be generalized?
That's a really tough question, Tom, and it's something that I think everybody's looking at. So we have the satellites, we have people on the ground that can measure emissions if you're close enough and you can get there. So there's that whole team, and then we have aircraft that goes in between. And so the Fire XAQ data did fly aircraft as well as the others, other campaigns. So they fly into it and then they go back and forth, and they're putting together the exact emissions and how they age across time and how they're transported. And it's done for a lot of different fires. So yes, we're trying to put the satellites and the ground-based information and the aircraft all together in one picture of wildland fire. It's a complicated story, and there's some really good papers recently by Liz Wiggins, could be Elizabeth Wiggins, W-I-G-G-I-N-S. Email me, I'll send them to you. So we're starting to put together all that information. We're at the beginning, but that's a great question. And you're moving towards the future, Tom, like I think you do often. Thanks.
I think, Amber, thank you for that. I think where we struggle is really on the health side. So when we can do that characterization, I remember talking to the FireX team before they went out, we just don't have the capability right now to follow people prospectively, unless they're in an occupational setting, like Jaime described, where they're exposed constantly. So I feel like as much as we can do some of these really great characterizations over space and time, and depending on the biomass, the temperature that it burns, there's also some new really interesting research by Leda Kobziar and her group about not only the chemical constituents, but the biological constituents as well. I think from the health side, some simplifying assumptions need to be made for us to move forward. And Randall, I know you're our moderator, but I think that you have some experience using the global burden of disease models to help us try to understand what assumptions could be made about PM, at least to get us a starting point to understand the health burdens.
Thank
Randall,
you, Sheryl.
I think that is to you. Yeah, that teasing apart the temperature from heat and everything else, it's just the health effects part is confusing. I can define smoke though, please.
Well, thank you for that shout out. And I realize there's a lot more questions and there's a lot more discussion we could have, but we are at 3:15. And so I do want to try to respect everyone's time and give them a time for that break that we all need before we pick up the next section. So I will close out the discussion here, and over to you, Alex, for any technical aspects of that.